This is the MRRA, the Minnesota Rehabilitation and Reinvestment Act. And really, this is a bit of it's a big change for how we would do corrections in our state. But what we know, if we look at recidivism rates, we know that the current system isn't working and isn't serving our constituents to the best that it can.
I would just remind people that this is what the Department of Corrections stands for. We are in the business of trying to transform lives, and that is fundamentally focused on the safety of our state.
When I first started my work in this body, I served on the Public Safety Committee, and the very first presentation we have from the Department of Corrections as a domestic violence prosecutor, I was horrified at the idea that the work that we were doing as prosecutors and advocates on the outside, we would send somebody to prison and then they didn't receive any programming. There was nothing individualized to their specific situation. So here we have this opportunity where we've interrupted this cycle of violence. We have this person, they're incarcerated. It's this amazing opportunity to sort of right the ship and get people the services that they need so that they do not reoffend, so that they become full contributing members of our community. And the current system doesn't typically do that. Typically, it's a holding space for people, and that's not to undermine or to speak ill of some of the programs that do exist, but what this bill would do would really recognize that each individual person might need something different so that they can thrive when they come back to our communities.
Historically, the view has been that victim safety is maximized by increasing punishments for offenders, and we as a coalition have helped to advance that thinking. But in working with our programs, listening to victim survivors, and looking at our intimate partner homicide data, we learned that accountability solely based on incarceration without changed behavior does not keep victims and communities safe. Victim safety is actually enhanced with good criminal legal system reform. What victims want is for the violence to stop and the behavior to change. Victim survivors have told us they want their abusers to have access to resources and education that could transform their behavior while incarcerated. And that overall, there is too much focus on criminalization and incarceration and too little on offering supports to address the abuser's behaviors while they are under correctional control.
We want the person not only to get the programming, but we want them to begin to demonstrate those skills while they're in. We also want to be in a place where, because of our assessment up front, we have a much better, a clearer sense of a person's needs and the ways that we begin to target and provide services that are more focused on that individual, or it could be culturally appropriate services. These are all things that we want to make sure that we're learning as a part of this. And right now, our system has been built to be largely one size fits all. And this really begins to target and focus based on individualized need.
Since the advent of the penitentiary in the early 1800s, we've seen time and again that when we just focus on punishing people, just locking them up, it does not and has not yielded good public safety outcomes. It hasn't made correctional facilities safer. It hasn't made communities safer. I think what we're proposing is consistent with the evidence that's accumulated not just within Minnesota, but from across the country, across the world. I think what's important to keep in mind is there's an incentive that if you participate in complete programming that reduces your risk, addresses your criminogenic needs, that's true for prison, but it's also true for community supervision. Like, there's an incentive to have your supervision end early as well. So there are multiple incentives along the way. And so I think that strategy, it's better for the people who are in prison, but it's also better for us as taxpayers, that it leads to safer communities.
If we somehow think that assigning two adults to live in a bathroom together with bars in front of them is going to result in the kind of change that is going to affect the safety of our state, I think we're kidding ourselves. And that has been the history. That has been what we have done. That has been, I think, the change in focus that has happened nationally. And what we want to do is make sure that we're doing everything we can to move them toward full participation and engagement in programs that will make a difference.
And if this were to have a salutary effect of easing the pressure on prison capacity while importantly accomplishing these other tasks of just making the population safer, population of our communities safer, not to mention the population of our prison guards, our correction staff inside safer, you know, as the prisoners are busy doing hopefully pro-social activities instead of dangerous activities. Probably everyone's better off in that regard as well.
I've had the privilege of going to the Challenge Incarceration program at Willow River a number of times, have had an opportunity to talk to some of the men there. What's been striking is how many have said, I went to CIP so I could get out early. I went to CIP so I could reduce my recidivism risk. I didn't go to CIP so I could become better at marching. I didn't go to CIP so I wouldn't have as much criminal thinking. But when they entered the program, it transformed how they thought about themselves. It transformed what their behavior was like. And if that's all it was, if it was just anecdotal, that would be easy to dismiss. And in fact, there are a few things that I dislike more within our system than anecdotal evidence, because it's not worth a whole lot. But we have data that shows CIP is not just effective, it's one of the most effective interventions that we have to offer. And it helps save the state money. So what people do while they're in prison, what they're able to access and do, it has an impact on safety, health, well-being of people who live and work there. It has an impact on recidivism, has an impact on employment, and it has an impact on mortality.
Close with, we talk about recidivism, and it's really important to have the data and look at those studies and look at those numbers, and we can kind of like nerd out on like seeing recidivism as a clinical number, but the reality is that every time we prevent a crime from happening, that is one, that's a fewer people impacted as victims, fewer families being impacted, and we really can't put a cost on all of the things, all the good things that could come from this bill when we finally move it forward.
If we don't take opportunity to change a person's behaviors and patterns while they are incarcerated, there will likely be another victim.
This is a massive change for our state, and yet we believe it's the right one if public safety is our core concern.